a special COVID-19 update with some of our fantastic community partners. We're joined by Stacy Petrover, who's the president of New York Presbyterian Valley Hospital Center, located right down the road in Peekskill. And we're also joined by Dr. Bill Higgins. And Dr. Higgins, I know I'm going to stumble on your official title, but I believe it's Regional Medical Director for New York Presbyterian. Is that correct?
That's correct.
Excellent, excellent. Thank you both for joining us. And we're also joined by our good friend and phenomenal advocate for our seniors, Chair of the Senior Advisory Committee for the Town of Yorktown, Rosemary Panio. Rosemary, how are you today?
I'm good. How are you all?
We're doing good. We're doing
wonderful.
Good. Stacy and Bill, I want to thank you again, and I just want to jump right into it because this is about COVID. And I put out a message to our community on Friday where I discussed some of the statistics regarding the active caseload in the town of Yorktown. We haven't received an updated file from the Department of Health since Friday, but at that point in time, Yorktown had 37 active cases. And while I recognize and understand that that's a very small proportion of our overall population, I also see other communities, such as the city of White Plains. And fact of the matter is, the city of White Plains has a greater population, more dense population, and the town of Yorktown, as of Friday, had a greater active caseload than the city of White Plains, which is why I put out the word to the community that we really need to refocus our efforts. And Stacy, I know this is something that you want to talk about, but we really need to remind ourselves that this virus is still here. It hasn't gone anywhere. And we really need to make sure that we're taking all the necessary precautions to ensure that we don't go backwards, back to a world of restrictions and social restrictions, business restrictions, and also putting people's lives in jeopardy. Stacy, do you want to just provide us with an update from the hospital standpoint as to some of the things that you all are seeing?
Sure. So we've been fortunate, Matt, and thank you again for having us a second time in this forum, because it's our pleasure to speak to and educate our community. We're all in this together, and we would like to be, focusing on our new maternity unit that's opening in December, but we can't do that without also making sure that our constituents and our communities are staying safe. And what we are seeing is an uptick in areas of New York City, Rockland County, Orange County, Brooklyn. And it does not bode well for how the fall and winter will go if we don't continue to utilize the practices that we know work. And what are those practices? Vigilant mask wearing, vigilant social distancing. And I understand that it was a little easier to achieve in the summer months when we could be outside and we could, talk to each other from far away. It's going to be a challenge, but it has to be a challenge that we all rise up to meet. Because if we don't, we will be in the exact same situation. Our hospital will be filled with, COVID-19 patients with COVID-19. And that will, make us unable to do the other work that we do. Mm-hmm. And that's, our elective surgeries and our preventive medicine, our colonoscopies, endoscopies, mammograms. Already, we see that we've not yet bounced back to pre-COVID in those preventive care areas. And I believe it's because people are, still a little skittish about coming back to hospitals and coming back to offices. I can tell you that probably one of the safest places you can be is in one of our hospitals or offices, because the vigilance of cleaning protocols that we have is extraordinary, as well as our social distancing changes that we made. We don't generally have waiting areas any longer. You come in and you are ushered right into an exam room or right into the area that you were going. Or if you are in a room, a waiting area for a very brief period of time, we have indicators of where you can and cannot sit so that we are ensuring social distancing. We screen every single human being who comes into the hospital or one of our medical practices. We ask a series of questions. We take people's temperature. We ask if they're symptomatic. Every single employee and physician in the organization has to complete an attestation on an app every single morning and take their temperature at home. And actually, when we come in, myself included, we get temperature scanned.
Yeah.
And so these are all of the efforts that we've put in place. That's all well and good for here, but what we all do outside in our personal lives is really important. And we've got to protect those that we care about by being vigilant in our mask wearing, being vigilant in our social distancing, and really making smart decisions. I've had 80 people on town hall Zoom meetings that we've spoken to. I have a whole schedule of Zoom meetings with different areas this week, different populations this week. It works. It works. It may not be our favorite mode of communication, but it is the mode of communication that we must employ right now to keep everybody safe. And my parting words before I turn it over to Bill will be, it is flu season. And as I was showing you a little bit before we started, I used to wait to get my flu shot, toward the end of the fall season. Again, no science behind that whatsoever, by the way, none. And I was the first one online. This is my little red dot, little purple dot that says I got my flu shot. First one online, because we all need to be protecting ourselves. You've heard about comorbidities and what makes you more prone to not do well if you get COVID. Certainly respiratory illness is a contributing factor. So don't get the flu, get your flu shot and wear your masks, social distance. We will get through this together. And New York Presbyterian Hudson Valley Hospital is your hospital, and we're here to take care of you no matter what. But we would much rather be doing your preventive medicine than treating you for COVID.
Stacey, I appreciate that. That's great insight for all of our residents, and especially with our flu shot. We're going to be, I've seen we have a couple of flu shot drives going on in our community. I know that the Elks Lodge is actually hosting a flu shot drive later this week. We're providing them for the first time for our employees. I've already signed up. My wife made sure that I did. So I'll be getting my flu shot this week as well. But I think that it's very important for people to understand that the parameters that we are putting forth are really just to make sure that we stay as healthy as we can for as long as we can and get through this particular season, and make sure that you're also giving special attention to those preventative measures, right? It's easier. I had a friend who is a chiropractor and a nutritionist, and he always said it's easier to stay healthy than to get healthy. And so that really goes towards those preventative measures that we can take to make sure that, like our flu shots, to make sure that that we all stay as healthy as we can at this point in time. Dr. Higgins, do you want to provide some insight from your standpoint, COVID related or otherwise?
Sure. Thanks, Matt. And thanks again for having us. And it's good to see everybody. And again, I'll just reiterate what Stacey was saying before. Zoom meetings are the way we're doing business now. It's the way we're doing my grandson's 3-year-old birthday party now. Between Stacey and I,
my 5-year-old's got his birthday party tomorrow, and everyone's on Zoom. So I'm with you.
There you go. Stacey and I took probably a total of 4 steps today, because basically all we do is do Zoom meetings.
Yeah.
That being said, as of yesterday, Joe Latimer gave his address. We have over 800 cases, active cases in Westchester County right now. And that's up by 300 cases in the last 2 weeks. We haven't seen it jump like that since back in June. In the NYP system, out in Brooklyn and Queens, we have hotspot zip codes that we're seeing upticks in COVID positive cases and ill people. In Westchester, I know we were mentioning before, Yorktown has over 30 active cases.
Yep.
30, yeah. Although we're staying at around 1% right now in Westchester County, but we have a hotspot in Port Chester. Port Chester is up to 8%. Wow. That's pretty significant. The medical group, we measure and monitor everyone we're testing, both down at Lawrence campus as well as Hudson Valley campus, and we're drilling down into the data. So the few people we had positive yesterday, to drill down into that data was One gentleman down there was actually at a wedding this past weekend, and it was, guess what? It's a super spreader event. There are other people at that wedding, and that again is to Stacy's point. I think we're all sort of sick and tired of being sick and tired of and socially distancing, but now is the time to really dig in and continue safe social distancing and wearing masks. Let me just bring up a couple of points regarding mask wearing. In Arizona, when they finally mandated wearing masks, the journal Nature did a study, and after masks were mandated in the state of Arizona, the infectivity rate went down by 75%. Clearly, masks do the job. Surgical masks are best. We don't need to wear N95 wet masks that we wear in the hospital when there's aerosolized procedures. Surgical masks are the best, and in our hospitals, all employees and visitors wear surgical masks. Yep. If you don't have a mask and you're out in public, a bandana is better than nothing. But surgical masks are good. They don't increase your carbon dioxide level. They don't prevent you from oxygen. If you're that sick that you're resistant to wearing a mask, you shouldn't be out of the house anyway. So mask wearing is imperative at all times in public. It's important. Again, we're preparing for a twindemic, and that's influenza and the coronavirus. And the same people that are susceptible to coronavirus are the same people that are susceptible to influenza. We have a vaccine for influenza. We should be taking it. Those of you who are over 65 should be taking the high-dose flu vaccine. Mm-hmm. The New York Presbyterian Medical Group for the last 4 weekends, I think, Stacy, we've been doing curbside flu clinics, and we vaccinated over 500 people. Wow. We've never seen that before. So I'm glad that people of Yorktown, Cortland, Peekskill are starting to take this seriously. But my biggest concern is with your youngest constituents, the high schoolers and colleges. Iona College closed down today. They've gone virtual because 60 kids down there tested positive. So for parents listening in right now, it's important to listen to your kids and listen to their symptoms. Fever, loss of taste, aches, pains. Listen to your child, and if that's the case, get them to see your doctor. And speaking of that, because I know we don't have much time, the New York Presbyterian medical groups and the other medical groups in the areas are up and open for business. We've put in every measure since the beginning of this pandemic to practice safe social distancing, terminally cleaning our offices. All of us who go into the office have our COVID app that you can't get in without it. And we're seeing people, we're vaccinating them, and we're taking care of their routine healthcare. And if I was to impart anything today to our listeners is we're at a 1% rate right now. We need to be careful. We need to socially distance. We need to wear a mask. But at the same time, you need to take care of your health. You need to get that routine mammogram. You need to get that colonoscopy. And you need to get your blood pressure checked and just regular health maintenance checkups. We've seen our volume in our offices are hovering around 90% now, which is very encouraging to me. That means people feel safe coming into our offices. And to Stacy's point before, I feel safe. I feel completely safe walking into any of our hospitals as well as any of our offices. I'm not that secure walking into places that I don't know how the cleaning has been. So if I was to impart anything to our listeners out there, it's to maintain your health. It's very important.
That's great and great insight. Going back to, if I can just quickly, the county executive did come out yesterday. He did he did post some updates regarding COVID. And yesterday we saw the most active cases, I think, since the end of May for in one day. And so unfortunately we've all been bracing for so much of a second wave. And if you're following the data, it sounds like that we are very much on that course. And so that's why it's just so important that we continue to emphasize. And that's I think, from our standpoint, I can tell you for me personally and for the town board, we just try to remind people and reemphasize the importance of the three basics, right? It's your mask wearing. I've got my mask right here. I wear this thing. I've got 4 of these. I don't leave the home without them. Obviously, I've got them in my car everywhere I look. But you got masks, number one, social distancing, number two. As a reminder, it is the governor did sign an executive order stating that if you can't maintain social distancing, that a mask is required. So just as a reminder of that, and that's within 6 feet. And the third thing is washing your hands. And I don't think, I can honestly say, I don't think I've ever washed my hands more than in my life than I have in the past year. I mean, in the past 10 months now. And I mean, I think those are the three basics that if we can all follow, coupled with, as you both have stated, both Stacy and Bill have both stated, the preventative measures. And those are just so crucial. Don't let your health fall at the wayside. We have, and as you've heard from our two health experts on the call here, we have the facilities, we have the ability to treat anyone for anything that they may have going on. But it's so important to make sure that you're taking those steps. And that's why I wanted to bring in Rosemary Panio, as I stated before. She's the chair of our senior advisory committee. Rosemary, you and I have talked about this. We've talked about it with our seniors. They can't just be sitting at home.
No.
They have to continue to take care of themselves. And so I didn't know if you wanted to just provide some thoughts on our conversation today for our seniors.
Well, of course, I'm always concerned about how they're managing with all these things that they have to do now. They're shopping, for one thing. We've talked about that, which is important because they have to maintain their diets. The socialization, I tell if I don't see someone that I normally see, for instance, at Mass on Sunday, well, I give them a call, my neighbors, and ask them how they're doing. Do they need anything? But I think it's important just to have contact with our friends, our relatives, our neighbors, and have conversations that we could not have on the outside at this point in time. So that's important to them. I worry about how much exercise our seniors are getting.
Yeah.
We hope to get our recreation people at one of our meetings. Matt, you and I talked about that, and let seniors know how they can exercise safely, even chair exercises, etc. So they keep themselves walking around during the day, even if it's in their own homes. Diet, how important that is, and also I think the socialization at this point in time is the biggest thing, because we really need to maintain that human contact. And so that's what I try to do. My husband and I, if we don't see someone at church or at any group or if we haven't seen them for a long time or heard about them, we just give them a call, ask them how they're doing. Do they need anything? Are they getting by? I get a little bit more intrusive. Are you eating properly? Are you moving around? But I think that's important. And I'm having longer conversations with people on the phone. Up to now, I've been seeing my family out on my deck. That's going to be a little hard to do, but we'll just stand on opposite sides of the room. We had a celebration for my husband, for Rocco, the other night. We went to a restaurant and celebrated his 80th birthday, and I could see the tables were far apart, and Gina, up at Little Sorrento's, gave us a big square table so we could not be that close to one another. It was really great, but that's an unusual thing because you only get to be 80 once. Some people don't get to be 80 at all. Right. So, but I'm concerned about the seniors. I have to say that I'm concerned. Is there any particular part of Yorktown where there is a higher level of contamination? Is there any age group in particular that you can figure out that's been more heavily affected? And I think about all these things, and you and I have tried to keep up every month with communicating with our seniors through our little program, because we want them to know that we do care about them. And if they have an issue, I tell them all, call Matt.
They do. Trust me, they do.
Rosemary, what I'm seeing is you're asking about the age group. I'm seeing younger and younger people who are testing positive for coronavirus. And that concerns me because up to 34% of them are asymptomatic. And my concern is that 34% of those asymptomatic people come and visit people like me and you who are in a certain risk group. Right. So that's why it's so important for everyone, not only those of us on this call, but especially our younger population, to be careful and to wear masks. One of the things I was reading about earlier are the kids on the fields who either score a goal or whatever, giving each other high fives.
Yeah.
That type of behavior has got to go, unfortunately, for now, and probably for the next year and a half.
Wow.
So it's being vigilant and teaching our youth of the different ways that we have to greet each other and congratulate each other. That's important.
The elbow,
The elbow.
the elbow, yes.
Yeah.
Rosemary, I'm particularly honing in on your concern about socialization. And one of the things that New York Presbyterian has is an absolutely outstanding IT department. And I'm pretty sure that if you had a group of colleagues and seniors that wanted some help learning how to Zoom and Zoom with their families, and if they had that, we could probably facilitate some of that instruction and host it and something like that. So I'm forming it in my mind as you're speaking, and I'm actually texting other people on our team to see what the opportunities are. But I really think we could possibly help with that.
Well, that's great. We would certainly welcome that. I have to call my 12-year-old. He's now 13. and he tells me, I told you, no, not to touch those buttons. But,
Yeah.
We're managing because we're very active in our own, not only in the community at large, but in our own neighborhoods. So we're pretty active. We kind of know everybody. So that's been very helpful. But I also make a point of calling people who I know live alone.
Right.
If they're living alone, if they're widowed or widowers, I will make sure I try every week or so to give them a call to see how they're doing, just so they know that people care.
Right.
That's got to be hard, to be living alone and also not being able to socialize.
Mm-hmm.
So we try to help them in any way we can with that. But it's a concern. I think that Matt has done a great job in addressing that concern, having his mother and his grandmother living in Yorktown, I believe, right, Matt?
That's right.
Yeah. So
My
he's
grandmother didn't talk to me for weeks because I wouldn't step into the house.
Yeah.
Away from the slider. and I have a feeling that we're going to be doing that again, unfortunately, just to make sure that she's, but it's for her own health. It's I want her to
Sure.
be able to, remain healthy, and she, and that's what she is right now, obviously. And so, I have to make those responsible decisions. And this is what we talk about. You make those decisions, not just for yourself, but for your loved ones. And it may be painful, obviously. And, I know that what it was for her, but I made the conscious decision to take that action because I wanted to make sure that she didn't get sick, and I didn't want to put her in that danger. And so, having that, those are socially responsible decisions that I think we need to, reemphasize to our entire community, because you just don't know. As you heard Dr. Higgins say, 34% were you're asymptomatic. So you don't know necessarily who you're coming into contact with, which is why that mask wearing and that hand washing and the social distancing, those three are just so crucial. I did want to just touch on one other thing, since we're just talking about socialization. I don't know, Stacy or Bill, if you have any thoughts on this, but on the mental health aspect, are there things that New York Presbyterian is doing that maybe we can incorporate into our community, especially for our seniors, our shut-in seniors? I know that our senior nutrition center, for example, we haven't let seniors back into the nutrition center. And I know that's been very painful for many of them, because that's where they get their motivation, and that's where they get to see their friends. And instead, we've been delivering our senior nutrition staff, who've been just tremendous, have been delivering the food to them at their homes, and of course, checking on them in a socially responsible way. But I'm just curious if there's any services that you would recommend that we as a municipality look into or can incorporate for our seniors who are home and looking for that interaction.
Sure, Matt, that's a great question. And I think how we can help is at our disposal in the New York Presbyterian system. We have a multitude of mental health and experts, as well as nutritionists, as well as people who specialize in exercise physiology. And we'd be happy to share those speakers with your seniors, Rosemary. I think that
would be great. That would be really good. Yeah.
But just going back to something you said before, I think is important, is we're in the fall right now, and the weather has just been spectacular. And for those seniors that can get out there, fresh air is one of the best things for us. Exercising in fresh air is a whole lot better than exercising on a treadmill or an indoor bicycle. So I would encourage everyone to go outside, wear a mask. There's great places to walk around Yorktown. So try to get out there. It's not only good for your body, but it's as we all know, it's good for our mental health as well.
Absolutely. And I'm sorry, Stacy, go ahead.
One of the things that we have been doing is, I think a lot of you know that we have a really great teaching kitchen and a wonderful chef, and our physicians partner with our chef, Emily Berner, to provide healthy ideas about cooking. And what we've been doing is doing those classes virtually. And so I think that we could certainly tailor a class to our seniors and do a few of those to at least engage, because as long as we get that IT support and everybody can get on Zoom and participate, you're seeing everybody's faces, you're learning, you're getting a recipe, and you're socializing, as well as maybe finding out how to support your healthy nutrition and immunity.
Yeah.
And they're also cooking, you know, I love to cook. As when I invite anyone to my home, I say, come into my office, which is really my kitchen. But
Best meeting you have in Yorktown, let me tell you.
but it's a wonderful pastime. I mean, the chopping, the cutting, the doing, that's a great way to spend some time in the morning doing something. I think it's great. I've also make it a point, though, which I failed to mention earlier. When I go shopping and I come in with my stuff, I wash everything off the cans, off the boxes, before I put them away. I mean, I maybe it's exaggerated, but I just feel better about doing that. But it's and the shopping, as you know, we mentioned, Matt, that there are a lot of stores that now deliver, so that people don't really even have to go out.
Yeah, we have deliveries. We have Ride Connect. That's still an option.
Right.
We still do have. We were the first community to establish the senior shopping hours in the morning for seniors and immunocompromised, which still, I think my understanding is, we'll check this, but still are in place. And the other thing I wanted to mention that Bill had talked about, getting outside. If I could just mention, we have the Yorktown, we have the track over at Veterans Field, which is a great place. We actually lined it this year. So now there's specific lanes for walking and passing and jogging to make it safer for everybody. And the other place that have been getting a ton of attention are our farms. Yorktown's got incredible farms, and it's a very safe place. Get outside, walk around a little bit. You're not in a confined setting, and you can purchase some fresh produce along the way that's grown right here in Yorktown. So, we do have some spectacular, and by the way, we do have over 40 miles of hiking trails that are here in the town of Yorktown as well. So that I always like to give a plug to. So, we are seeing extensive use of our farms and our hiking trails, and I don't think the track has seen this much action in a generation, but people are out there using it. But I think we just have to make sure that they're using it safely, that they're making those socially responsible decisions. Remember, it's not just about you; it's about the people that you're going to come in contact with later in the day. And
I do see a lot more people walking around town.
Yeah,
and you could tell they're having a walk, because it's either couples or individuals with their dogs. I do see more of that, so that's good.
Yeah, I was with Yorktown. I stopped in Yorktown Cycles over the weekend. They are having a record year. They can't keep bikes in their shop, and which is in some aspects great, because people are utilizing them and they're doing great business, and people are utilizing the natural assets we have here in town. But it's just refreshing for me growing up in town here. I remember growing up, and we were always outside in rollerblades and on our bikes. And we kind of got away from that, I feel like, a little bit. And now I drive around in our neighborhoods, and there's kids on their bikes, and they're outdoors, and they're being reintroduced to that kind of I think social setting, which I think was just nice to see. But again, if I can just echo one of the things that Dr. Higgins had said, is just for my fellow parents, let's not take advantage of the situation. If we can just make sure that we're keeping a close eye on our kids. If they are having symptoms, you're bringing them to the doctor. If you're waiting a test result, please don't let them go to school or on field or over a friend's house. Let's just make sure we're taking those extra precautions necessary to keep our community safe. And that's all we're trying to do, is just reemphasize that to everyone in the town of Yorktown. I know everyone's got a tight schedule today, so I just wanted to, Stacy, any last thoughts for the community?
I just want to say thank you again. And the people that have control over this and its spread are us. It's all of us on this Zoom meeting, all of us in the hospital, all of us in this county. We can do it. And it's every single individual who needs to contribute to that. We're here for you. We're your hospital. We're growing and expanding. We have new MRI equipment. We have a new maternity unit opening. We're reaching out to communities all through Westchester County and Putnam. And we want to take care of you, but we want to take care of you for the right reasons, not because we didn't socially distance or because we didn't wear our masks properly. And I see Bill is doing our usual public service announcement about proper mask wearing. Dr. Higgins.
Thank you. So not only are masks useful for protecting ourselves, which you know it is, but it's also protecting those around me. And it's very important to wear your mask that covers your nose, your nostrils, and your mouth. So this doesn't help, and this certainly doesn't help. And I've even seen this. I mean, it's got to cover both. And another thing a mask does, by the way, is it prevents you from touching your face, which is important because mucous membranes, your eyes, your nose, your mouth is where the virus gets in. So it's very important to wear a mask properly. And my office is right down the block from FDR, and I am encouraged to see that people outside are wearing their masks because FDR gets crowded and not all the time can you socially distance 6 feet apart. So kudos for everybody in the park down the block for wearing their masks and getting some fresh air. And it is perfectly acceptable, by the way. If there's no one else around, you can take off your mask.
Good.
Thank you, Dr. Higgins. I appreciate that. Rosemary, any last minute thoughts for our senior?
No, I just said, I'm also equally concerned about the youngsters because I can't imagine going in my school years, not seeing my friends and not going to school every day. So I think we have to be cognizant that we need to help them out as well.
Yeah.
So it's important. I'm very concerned about that.
Yeah. Well, I can tell you with a kindergartner at home, he wakes up every day asking if today's a day he gets to go to school. And it really is heartbreaking, to be honest with you, because he gets so excited when it's the days we do let him go. It's a hybrid model that the Yorktown Central School District is implementing. And the days that he gets to go in, he just lights up. He's excited as excited as could be. And so really, I think it's our responsibility. Do it for them. Do it for the kids so that they can get back to the life that we all want them to have.
Yeah.
And do it for your neighbors and do it for your seniors. Wearing a mask, washing your hands, practice social distance. Do it for each other. And I understand that people are frustrated with it, but it's for your own health and wellness and for that of your loved ones and your family and friends. So again, I want to thank Stacy Petrover and Dr. Bill Higgins for joining us. It's so great. I wish we were here talking about the new maternity ward and all the other great things that you're doing, but it's just so important for us to remind everyone at home that masks work, social distancing works, washing your hands works, and please make those socially responsible decisions so that we can get through this. It was like a double header. What did you call it there, Dr. Higgins? Or was it
Twindemic.
I'm sorry?
It's twindemic.
Twindemic. Yes. Yeah. So let's just work together. And as Stacy said, it comes down to us. So thank you again, everyone, for joining us and for
Thank you. Stay well.
Thank you very much.
Thank you very much.
See you soon. Thank you so much.
Take care.
Bye-bye now.
Bye.